Hello everyone and welcome to another Rapid ECG session with Pekga. Today we're going to be taking a look at this 12-lead ECG. Of course, we're going to be building it up from a single channel. Right. Before we get into it, I do want to remind you to develop your own methodology or your own system of analysis as you develop your ECG skills. This is what we use at Pekga here, 3 steps, right? First thing we look at is what stands out, then we go into measurements, try to correlate that with symptoms. And as you can see here, when you align these 3 rings, right, it will allow you to do ECG analysis. All right, let's get to it. So somebody hands you this 10-second strip. Again, why do I say it's 10 seconds? Because this is just we're looking, right, this little strip is exactly this little segment down here. Any 12-lead ECG, when you get this printout, is 10 seconds long. Each one of these channels here is exactly 2.5 seconds long. There's 4 of them in a row, which gives you 10 seconds. I know I'm kind of beating a dead horse, but here today it's for a good reason. So the first thing that, excuse me, let me backtrack a little bit here. The only thing you can reliably pull off of a single channel strip is rate and rhythm. Now, looking at this, the thing that really stands out to me right off the bat is the fact that the rhythm is irregular. If the rhythm is irregular, so is your rate going to be irregular, right? So you cannot use the 300 or the 1500 rule here reliably. You can use it painstakingly, meaning you can measure each one of these intervals here and then average it out. But what I'm going to do is I'm just going to measure how many QRS complexes I have on this strip here. 1, 2, 3, 4, 5, 6, 7, 8, 9. Now there's 9 ventricular responses or QRS complexes here. The heart rate is measured in beats per minute, right? So I have 10 seconds here. I have 10 seconds here. To get up to a full minute, I'm going to have to multiply this times 6. 6 times 10 gives you 60 seconds or a full minute, right? Since we have 9 beats here, 9 times 6 will give us a heart rate of 54. Now that is an average. It could be a little bit higher, it could be a little bit lower, and there could be a lot more of a rhythm happening, beyond these 10 seconds. But for right now, this 10-second strip that we're looking at, a heart rate on average, when it's averaged out, it's 54 beats per minute. Okay, so we have our rate, right? We had to average it out. We have our rate. As far as the rhythm, I'm looking for P waves, but you cannot see them. However, what stands out is this funky baseline. So see how the baseline, you don't have a baseline here. So right, whatever's going on here, it never reveals an isoelectric baseline. So there's something going on that is constantly agitating the heart. And when you see this pattern, we call this a sawtooth pattern, you can immediately associate this with atrial flutter. Now, a shorthand for atrial flutter is AFL. So if you see this somewhere, you know that they're talking about atrial flutter. Am I sure this is atrial flutter? No. I'm going to need a little bit more to confirm this. However, so far, if somebody asked you, what are you looking at here, I would say atrial flutter at 54 beats per minute. Now let's get to the 12-lead and let's see what the 12-lead reveals. All right, again, going back to basics, what stands out? Look at this. Look at these. Look at all these P waves, right? Normally, you would call them P waves. However, if you are fairly certain you're looking at flutter, you call these F waves, or flutter waves, or fibrillation waves, depending on whether you're looking at atrial fibrillation or atrial flutter. However, we do have flutter happening on the baseline. So Again, I always keep on going back to the method. I want to take a look at my axis of depolarization. That's just a habit, right? So lead 1 is upright, lead 2 is upright, lead 3 is down. Going to our axis diagram here. Upright, 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 indeterminate, downright. So my axis of deviation is somewhere between 0 and positive 30. So we're still in the normal range. One side note here, when it comes to left axis deviation, that starts, the pathological finding starts at negative 30 and beyond, right? Negative 30 to 0 is considered non-pathological left axis deviation or normal. Okay, going back to the 12 lead, excuse me, yeah, 12 channel strip. So, okay, the axis is fine. AVR is inverted. That's good. AVL is looking fine. AVF is most isoelectric, and that's another way you can kind of figure out what your axis is, right? So this is isoelectric. If I were to go back to the ECG finder, another method you can use is lead AVF is going straight up and down, right? It's going straight up and down. So the lead AVF is isoelectric. So whatever's going on, it's happening exactly at 90 degrees to it. The lead at 90 degrees to it is lead 1, right? Lead 1, if you recall, was upright. So chances are this just confirms that our initial speculation was that the axis of depolarization is right around 0, maybe a little bit more positive. Here you would say it's right at 0. So just another method of deduction. Okay, now there will be a link to a deep dive video on atrial flutter where we go into different types of flutter. And the heart rate here is a little bit concerning. Okay, but we're going to leave that for the deep dive video. However, taking a look at lead V1, and when it comes to flutter, it's worth noting leads you should be looking at are inferior leads, 2, 3, and AVF. In these segments here, it's very difficult to tell what's going on. The baseline has a lot of artifact. However, in this expanded view down here, right, you can definitely see flutter waves. So we are dealing with flutter. In deep dive video, we're going to be going into what kind of flutter we're looking at. Lead V1 is also an excellent lead when it comes to looking at anything going on in the atrium, right? In the right atrium. Left as well, but right definitely. So here we have a confirmation, right, that we don't have an isoelectric baseline really ever. There's always some sort of movement going on, and we are looking at flutter. The ventricular response is at 54 beats per minute. So if you were to hand this sheet of paper over to somebody or to put it down into your system as far as what your analysis is, what I would write on there is atrial flutter. Remember AFL, right? Atrial flutter. We have a slow ventricular response at 54 beats per minute. And in the deep dive video, I'm going to be going into why 54 beats per minute is a little bit concerning and what you would have to do to make sure that you can leave this patient alone. Okay, the low heart rate and high heart rate when it comes to atrial flutter is a bit of a concern. So check out the deep dive video. In the meantime, thank you for joining us in this short little rapid ECG session. But today we got a chance to see atrial flutter with a slow ventricular response.